Welcome back, everyone. Dr. Petersen is joining us today from Hortoff Medical. And you know, this subject, we're talking about thyroid. We mentioned yesterday we'd be talking about this. And I think this is fascinating to me because I was reading through some of your notes. Lots of symptoms, if you're wondering, you know, I don't know if I have thyroid issues or not. Lots of symptoms that I think people kind of pass that by and go, well, my hormones are off, or well, this is off, but maybe they're not thinking, because you were saying your thyroid actually goes, it ages too.
Sure.
Right?
Yeah, all of our hormones go down as we age. And perhaps we blame it on menopause. We say, well, of course, I'm going to feel this way because I'm going through menopause. But thyroid, the thyroid hormone, T3, there's a receptor for that hormone in every cell in your body. And the purpose of that hormone is to tell the particular cell that it attaches to work faster. So name a tissue in the body, your eyes, your brain, your skin, it will work faster if you have T3. So, of course, the symptoms then are really broad.
Right.
From weight gain to fatigue to cloudy thinking to dry skin to constipation. Just the super long list, because everything works slower if it's not there.
Okay, so if you're thinking, I've dieted, I've tried, and let's just talk about thyroid from a point of view that you gain weight, because it's not always about that, right?
That's true. Sometimes a small fraction, 10% of patients with low thyroid can't. They are underweight and they cannot gain weight. But the majority are overweight and cannot lose weight now.
Okay, so say a person out there has tried every diet, they exercise, they are very religious and faithful about trying to make themselves healthy in that way. They're getting no results. Should they just come in and get tested? Possibly? Is it that something could be going on there? No,
that's a good point, and the answer is probably yes. There's a molecule called reverse T3, and even if your TSH and your T4, those are the molecules we usually check, the lab tests that we usually check, even if those are normal, if your reverse T3 is now high because you've over-exercised or yo-yo dieted or been under stress from other things going on in your body like menopause, the stress of having your third child, the stress of having a surgical procedure, whatever it is.
Like hit the whole list.
Your T3 versus your reverse T3 gets out of whack. Your reverse T3 goes up, your T3 now, even if it didn't go down, is low relative to the reverse T3, and so now your metabolism is stuck where it is, wherever it is.
Oh,
and you have to change that ratio so that you can start to have your metabolism improve.
So you can get your results. Again. Yeah. Okay. So how do you know if the thyroid issue really is the blame for all of this?
Without blood work, you can't know, and I think it's oversimplifying it to say, oh, the thyroid is to blame. I use an analogy of an automobile. The thyroid is really like the accelerator.
Okay.
And if your accelerator doesn't work, you're not going to be able to go faster. But if your clutch doesn't work and you can't get from first gear to second gear, sure, you can go from 0 to 10 or 12 miles an hour, but you're really revving the engine. And that's sort of, the thyroid is the accelerator. Those other endocrine hormones are maybe the clutch and changing gears. And so if your testosterone, progesterone, estrogen are low, well, you're able to change gears. But if you only do one of those two things, okay, fine, your clutch works great, you're changing gears, but you're not pushing on the gas. Or you're pushing on the gas, but you can't get out of first gear.
Okay. What about, because I'm just curious, women typically have more weight issues than men, right?
Right.
Is thyroid an issue for men as well?
Oh, absolutely, absolutely. The difference is men have more thyroid receptors. And so their thyroid level will go down, and because they have more receptors, it doesn't affect them as quickly. Women have fewer thyroid receptors, and so a small decrease in their level of T3, they'll start to have symptoms and say, what's going on? They also have the dramatic disadvantage of having progesterone and estrogen fluctuate every month from the age of 13 or 14.
Who do we talk about that? That's just not fair. Can we stop that cycle,
No, yeah, you're going to have to talk to God about that.
Okay, so what are some of the symptoms that people should be kind of maybe thinking they need to be aware of?
One thing I would say that women notice, men never, well, a few men notice this, but women notice this and say, what is going on? Dry heels. If you have to go get a pedicure all the time because your heels are dry, if you're sanding them off in the shower, you probably have low thyroid.
Serious?
Yeah, serious. Another thing, and you don't see this until later, but your eyebrows, they'll get really thin out here on the edges. If that's happening, you probably have low thyroid. Now, women do notice that, but that's a little later. Thin hair, dry skin, dry eyes, constipation, if you're tired, you're dieting and you can't lose weight, There's a lengthy list of things that will happen if your thyroid isn't functioning.
Wow. Okay, so what do you offer other than a diet that people can do to help this?
Well, you can measure a patient's basal metabolic rate. It's the same apparatus that's used in the intensive care unit to see if someone that's on life support is burning calories like they should. We just measure your carbon dioxide and oxygen exchange and say, oh, what's your basic metabolic rate? And how is your thyroid affecting that? Of course, we do a TSH and a T4, and then the T3 and reverse T3, and the antibodies against thyroid. We also look at the other hormones because that's really just as much part of the picture. Then there's also a test where you can check the patient's brachioradialis or Achilles reflex, and you say, okay, if the reflex is low, then they don't have high tissue levels of thyroid. It was developed by a physician from New Zealand. They use it in Europe a fair amount. It's called a thyroflex. And so even if your blood levels are normal, if your tissue levels are low, maybe you have too much sex hormone binding globulin that isn't releasing thyroid, and so you still don't feel right.
Wow. All right, so if you went through the list and you're like, okay, did that, got that, all that kind of stuff, you're thinking, oh no, maybe I should go have myself checked. It's super easy. We will get that information to you. Holtorf Medical Group, there's the site right there. Go to our website at forutah.com and click on Good Things Utah, and we will have all the information up there. You can go give Dr. Petersen a call, come have a consultation, talk about this. I know you have helped so many people that were suffering from different parts of, fibromyalgia, whatever it might be, all kinds of different stuff. But we appreciate you coming back, and I'm sitting up straight because your daughter told you to sit up straight.
Liza told me to sit up straight.
Liza, he did good. He did good. All right, Glenn, what's coming up next?
Coming up next, is this just a squishy mess, or can it help you clean up your house? It's our pin of the week, and it's next.